This is CT IVU of a 42 years old female patient. She had hysterectomy about 10 days ago. Now patient has presented with the urinary incontinence. Foley's catheter was passed, but even then patient complains of passing of urine into the pamper. Patient basically was sent for the ultrasound of pelvis to me. On initial examination, when the patient was examined, just after lying down, there was no urine in the vagina, but later on, after a couple of minutes, urine accumulated in the vagina. The patient was examined twice and repeated the same procedure. The urine accumulated in the vagina, so a possible diagnosis of vesicovaginal fistula was given. Now the patient has been sent for CT IVU. Now this is the plain scan. Now please observe, this is the urinary bladder, Foley's catheter tip. Now this is the vagina and fluid is present in the vagina. Now I will show you our sagittal scan. This is the sagittal scan of the plain scan. Now please observe that this is the site of communication between the urinary bladder and vagina, this one here. So there is a vesicovaginal fistula. Now I will show you the delayed scan of the CT IVU. This is the delayed scan. Now this is right ureter, this is right ovary, this one here. This one is the left ovary here. As I scroll it down, now this is the site of communication between the urinary bladder and the vagina, this one here. The contrast medium has entered vagina. This is urinary bladder, Foley's catheter. This is the vagina here. This is Foley's catheter balloon. Now the contrast medium has spoiled the pamper. Now I will show you our sagittal scan. This is the sagittal scan. Now please observe the irregularity along the superior surface of the urinary bladder. Now this is the site of communication between the upper posterior wall of urinary bladder and the anterior surface of the vagina here. This one is the site of communication. The interface between the anterior surface of the sigmoid colon with the vault of vagina is indistinct. This most probably represents the adherence here. So this is the oblong contrast filled vagina. This is the 3D reconstruction of the CT IVU. Both the ureters are normal. There is no communication of ureters with the urinary bladder. Now this is the contrast filled urinary bladder, while this is the vagina here. So it is basically the vesicovaginal fistula, and none of the ureters is involved by the surgery or in the urinary incontinence.